Hey everybody, it's Ed Dellert here, and a final question in my continued dialogue with Dr. Carter as he reflects on his presidency of 2025-2026. And I think this is one of the most important questions that I wanted to ask, which is as you transition from the role of president of ABA and thinking about what you have done with this organization, and what message would you want to leave with board members, general ABA members, and where we are headed as an organization and the role that everybody plays in shaping the continued journey of burn care and this profession?
Well, thank you, Ed. I think one of the biggest lessons this last year, and one of the things that people need to take with them, is how far the ABA has grown in the last couple of years, especially this last year. We've gone from a community that focused very much on ourselves and our patients and their survivorship to really the whole aspect of care. We're now very active with an Economics and Access Committee. We're wanting to tell the story of burn survivors and make sure that it's measured in a meaningful way, because good intentions don't always equal good outcomes. And we need to make sure that there is a margin for the mission that we want to have at all of our burn centers, and that's a sustainable mission for all of our team members. And so that is something I'm very proud of in the work that Dr. Travis and her team on that committee have done. Additionally, we have really grown the work of the disaster mission, and that is something that we need to not forget. Our community has a social contract with us, and they're going to expect us to be there in the event of a disaster. Whether we want to be there or not, it's our calling to be there. Next, our organization has grown to be able to look and to venture into more broad education. In other words, we've had ABLS for many years, we've had our national conference for many years, but learners want to see things differently. They want to experience and they want to grow in other ways besides just having an in-person class or maybe an ABLS online. It's exciting to see that the ABA is now tackling, learning in bite-sized pieces for different people for different purposes, and that we're going to have an LMS that's going to continue to grow. The strategic vision was an enormous challenge. It was wonderful because we did it very differently, where we now have 15 goals, and those goals are spaced out over the next 3 years, and they directly request committees to work on projects with them. I want you to remember that those goals are not our only goals, but they're the things we're really going to focus on. And when you have an idea, see how it might nest and fit into one of those goals. And if you're on a committee that's not directly tied to one of those goals, see how your committee might help advance that. It's also really important to look that, Ed, you and some of the central office staff have brought some new skills to our organization. It's exciting to see Doug there to be able to help with advocacy. It's exciting to have Sarah there with her background in education, Sue with her ability to help us be able to discuss and present burns in a more meaningful way to our community. I've traveled a lot this last year for both work, also for research and other things. But what I've found in my travels is that oftentimes when I get in an Uber and I'm riding from an airport in a different city, they don't know that there's a burn center there, or they might have heard about it, but they don't understand what they really do. And we need to tell the story of what burn care is. Oftentimes, members of the ABA say that we're a small organization. We're only as small as we see ourselves. We need to have the ambition and the excitement to be able to see ourselves as much more. I think the next couple of years, we have some exciting projects that are going to be moving forward. Dr. Harrington's going to be leading a quality initiative, really identifying how value is captured in both the verification and the quality programs that the ABA has. I'm very fortunate to work with Dr. Cancio under his leadership in this upcoming year, and Dr. Shupp and many others, and a great team that's going to be focused on a feasibility study to see if we can have an endowment for the ABA. It'd be a great way to help develop our members for future generations of burn providers. There's just so many aspects of the ABA that are exciting right now to be part of. And hope that you see yourself as part of that, because the ABA is a family for all of us. Thank you.
Thank you, Dr. Carter. That's a great summary, and I appreciate it, and very much appreciate that I was along for the ride in the backseat of the car. So I appreciate that. Thank you.